Hello and welcome to the Neuromuscular Junction with Dr. Mark Tarnopolsky. Today we're going to talk about Facioscapulohumeral Muscular Dystrophy, otherwise known as FSH muscular dystrophy. This is a muscle disease that affects muscles in the face, the shoulders, the lower back, and the legs. This can all lead to significant disability. There are no definitive treatments for this disorder, but definitely exercise and diet can be an important component to improve your quality of life. So we're going to get into that today in this video as we get into a bit more detail about the disease and what we can do to improve your quality of life. If you or someone you know has FSH muscular dystrophy and is looking for practical diet, exercise, and lifestyle advice, please ring the bell for further notifications about videos in these topics. Don't forget to like the video and subscribe to our channel. Now let's get into it. FSH muscular dystrophy is a genetic disorder. It's autosomal dominant. That means that if you have the disorder, you pass it on to 50% of your offspring. There are 4 types, but by far and away the most common is FSH type 1, which we know most about. But at the cellular level, they're really pretty similar. So what happens with FSH muscular dystrophy type 1 is there's a deletion in part of the gene, and that deletion affects a process in our DNA called methylation. So methylation is essentially a chemical that gets stuck on the DNA, and methylation can alter how DNA gets expressed. So our DNA makes RNA, which then makes proteins, and if there's a methyl group stuck on it, it will often suppress or downregulate the expression of the DNA. So what happens with FSH muscular dystrophy is there's a gene called DUX4. DUX4 is really important in cells when we're a baby. So as we start to grow and our cells are fusing together before we're born, DUX4 is really important in this myogenesis, we call it, or the building of new muscle. What happens is that normally we have a methylation which silences the gene so we don't express it. With FSH muscular dystrophy, we lose that methylation and we overexpress or keep expressing DUX4 in adult life. What happens with the DUX4 expression is that we have essentially 3 things that are affected in the muscle. One of them is called oxidative stress, the other one is mitochondrial dysfunction, and the other one is inflammation. It's been well described for many years that those 3 processes occur, and there's been some really interesting work showing that certain types of multi-ingredient supplements can actually have a beneficial effect by mostly suppressing these free radicals and lowering oxidative stress, which then is going to have a beneficial effect on mitochondrial function, and if they work better, you're going to lower inflammation. So those 3 processes are really tied together. What's interesting is that exercise also can target all of those 3 pathways. It's well known in older adults and many other disease situations that if you do exercise properly, you can improve mitochondrial function, you can lower oxidative stress, and you can reduce inflammation. So there's some people that inappropriately think that when you exercise, you will get more inflammation, you'll get damage to the cells, and it's not a good thing for people with muscular dystrophy. However, it's pretty clear that with endurance exercise, there's an improvement in function, an increase in mitochondria, which we measure as what's called the VO2 max. John Vissing's group has definitely shown that. We have gone back over the last 10 years and looked at our patients who exercise 3 times a week or more and those who exercise less than once per week. And what we found is that for both the arm strength and the knee strength, people who exercised largely preserved their function over that 10-year period, whereas those who weren't exercising had an approximate 36% decline in their function, clearly showing that if you maintain exercise over a longer period of time, there can be benefits. Now, during that time period, we also have been recommending some antioxidants based on some really nice work that's come out of the French group who first showed that giving antioxidants and mitochondrial enhancers actually allowed the muscle cells to fuse together. So we've always, at least over the last 10 years, been advocating for some antioxidants as well as exercise therapy. So in general, with muscular dystrophy, we like to do both endurance and resistance exercise. For endurance, your ultimate goal is to get to at least 30 minutes 3 times a week with moderate intensity exercise. And there's many different types of endurance exercise. Bottom line is do the one that you enjoy, because that's the one you're going to do. And we're going to show you specific videos about how to perform safely a whole bunch of different types of endurance exercise. Choose the one that you like and stick with it. If you want to try something new, again, we can show you how to do that safely. We also would recommend for all muscular dystrophies to do resistance exercise. For most disorders, including FSH muscular dystrophy, we like to do 3 sets of 12 to 15 repetitions. And if you go to our video on coming to terms with terms, you'll know what all of those things mean. And again, all the ways that we can do it with TheraBands, with machines, with free weights, we're going to have specific videos on those. But with FSH, there's a couple of specifics that you need to think about. The shoulders are very prone to injury with FSH dystrophy, especially if you have your arms out to the side. You'll probably notice if you lift the arms out like this, that the shoulders will come up. When that happens, there's more stress through various parts of the shoulder, and you can increase your risk for damaging the cartilage, tearing some of the muscles, sometimes called the rotator cuff tear. And one of the ways you can help to avoid that is to keep the elbows in tight. So if you're doing exercise, make sure your elbows are touching your body. This is a bicep curl, a tricep press down, internal and external rotation. That's very important. We generally would recommend that you avoid things like free weights. So using a free weight over your head like this is really putting a lot of stress on the shoulders with FSH dystrophy. So we wouldn't recommend that. Now, holding on to a cable, for example, and pulling down is safer than pushing up with something. Another little trick with FSH muscular dystrophy, and I'll show you from the side here, is that if you put your back up against a wall so that your scapula is fixated on a wall, when you're doing your activities, it'll help to keep the scapula fixated so that you're not getting that extra movement which could increase your risk for damage to the shoulders. So again, please subscribe to our channel. Take a look at some of the other videos, keeping in mind those FSH specific tips. So this is the general introduction to FSH muscular dystrophy, and we're going to get down to the very specific exercises in a subsequent video where we show you exactly how to exercise and what to avoid specifically with FSH muscular dystrophy and how to do things safely and effectively. So we hope that this video has given you some initial tips, some ideas about FSH muscular dystrophy. As I mentioned, the specifics are going to follow soon. Please subscribe to our channel and click the bell if you want to be informed about future videos that we're making in this and many other areas related to muscular dystrophy and other neuromuscular disorders. Be sure to like the video and leave us some suggestions in the comments section below. Thanks.